Good afternoon, everyone, and welcome to this session of dtalks or Disruptive Literacy Talks. I'm your host, Mashood. When we talk about moving on with this journey of achieving universal foundational literacy and numeracy, something which SDG 4 talks about, something which the National Education Policy has committed to, it is very important to understand how we can leverage synergies, be it between the different government stakeholders, between government stakeholders and civil society organizations, corporate sector. And because education, as we are aware, is one field where all stakeholders need to contribute, and they have been contributing in the past many decades as well. But it is more easier said than done when we talk about collaboration, because we are talking about collaboration between organizations which might have different goals, different priorities, and different ways of how they move towards achieving a similar goal. And in order to build synergy, it's important to kind of have that trust and kind of explore how different organizations with very different fundamental frameworks can work together to create social impact on a large scale. And Dasra is one leading organization which has been really helping create these chains of change, of really kind of building collaboration and synergies within the system to create a positive social impact. And to speak on today's topic, which is essentially on how we can fill gaps and kind of within the education system, especially post the pandemic, through a collaborative approach. We have Ms. Shrutika Jadhav. She is working at Dasra. She is the manager of transformation and impact. She has also been leading the direct implementation of the Dasra Adolescents Collaborative, and has also worked in several roles, including grant management and capacity building as well within the Dasra Adolescents Collaborative. So thank you so much, Shrutika, for your very valuable time and for joining us here today on dtalks.
Thanks so much, Mashood, and congratulations on this series. And it's so important to kind of talk about this, especially at the time that we are in. So I'm happy to be a part of it. Thank you for inviting me.
Thank you, Shrutika. And you join us on a very special moment because this is the 100th session of dtalks.
Nice.
We started around 3 months back, so we didn't expect to have reached 100 speakers. But thank you so much for being our 100th speaker and scoring the century here with us. To start with, Shrutika, would you like to share a bit more about we all of us follow Dasra's work in philanthropy and the amazing work which you guys are doing in WASH and adolescent health and education. Would you like to share a bit more about what your specific vertical in Dasra is looking at, and how has the pandemic how has Dasra adapted its work with respect to the pandemic and its impact on all sectors?
Sure. So a quick brief is that my now journey at Dasra, I've been a part of the Adolescents Collaborative. And as the name suggests, that as a collaborative, really it is bringing different players together to work collectively on some of the outcomes for the age group of 10 to 19-year-olds. And one of the outcomes within that is ensuring that the beneficiaries, and so our adolescents, complete secondary school. And so through that, it's sort of to say that when you think about what that age group needs, it's not just to say that they need only health and they need skills, but they need to complete school, they need the knowledge on their healthcare, they need more empowerment and agency. So it's to say that how can we take a more holistic approach towards the needs of a particular age group, and in this case, adolescents. And so completing education is such an important mark for the adolescent, because it gives them, we know the research, it delays marriage, it improves economic opportunities, it gives you more agency and empowerment, which also has a spiral effect on generations to come, especially if it's a girl child. And so it's to sort of understand that through our work in the collaborative, it's to understand that education cannot be looked at in a silo, and that there are so many other important goals that you achieve with ensuring that the child stays in school, completes school, and learns effectively as well. So that's one. And we obviously support organizations who do this work, and have been doing it in the sector as well. The second is also that education continues to remain one of the sectors in which we have seen interest from philanthropy, HNIs, foundations, etc., to want to support. But the sector is also very fragmented. There are different players. Everyone is doing different things. There's some who work on teacher training, some who work on principal training, some who work with government schools, private schools, some who work on socio-emotional learning, curriculum, etc. So really, our work also is then to support the philanthropists, and those who want to sort of give money to the organizations and figuring out where they need to invest, what is the current status in India within education, which organization is doing what kind of work, and so kind of really taking them along this learning journey to ensure that what they want to invest into the sector is really the most impactful way. And we've sort of seen a shift over the years from the philanthropists. There were a generation who would want to like build a building and have their name there. That was one way of giving, and now it's become a lot more strategic to say that it's not about putting up a building with my name on it. That's all. That infrastructure support is important. It's moved on also to say, okay, how are children learning? Where do they need the support? Where are the gaps? So that's a little bit of sort of taking them on the learning journey. And the third is really the organizations themselves. As NGOs go through the journey of their work, they need some hand-holding and support as they become those organizations who become centers of excellence for being able to drive their mission further. And so how do we handhold the organizations, support their operational capabilities, financial resources, HR, all of that's needed for them to be able to really have a single-minded focus on their mission and scale their work. So these are some ways in which that we've continued to support organizations that work in the education sector, support philanthropists, and generally drive the conversation and dialogue on education as well.
Truly remarkable work, what you and your team are doing, and especially at this time where we see a lot of struggle, especially it is of course a major crisis for everyone, but even for at the organization level, we are seeing lots of organizations, grassroots organizations, kind of struggling to adapt to this new normal. One thing which is truly remarkable is, and which is very important also, is connecting people and organizations, philanthropists who would like to make an impact by giving support with the right organizations which are sincere, honest, innovative, and have the capacity to implement. Uh, we sometimes see that there can be a knowledge gap between both the implementing organization as well as the donor organizations. How does Dasra address this gap?
Yeah. So I think it's a great question, and I think we have to first understand a little bit of how organizations themselves go through their journey, and that's something at Dasra over the years we've sort of built our understanding on it as well. And I think one is that when NGOs and organizations they begin with an idea and really to make that change happen. And so they're so focused on doing that. And once you start seeing the change and you see that, okay, this is working, I've built this model or this product or whatever the service that I was wanting to give, it's working, and I can see that it's impacting the beneficiaries. Now what next, right? So then they are going through this journey of what we call as, you have your proof of concept, it works, it. Now you want to take it to scale. So from working in, say, one village or one district, how can you take it to a state level? And in doing that, each organization goes through certain operational challenges that it needs to resolve, so it's better prepared to reach that scale. Because in the event that you're not able to address that, you probably find yourself in a state of burnout as an entire organization, because your targets and your aspirations and your visions getting bigger, but you might not have the resources, both financial and people, ready to take that on in its entirety. So how do you think about things like leadership capabilities needed, or a second line of leadership? Sometimes they're so founder driven and founder vision driven that you don't think about having that second line that you need to keep your organization stable and supported. So I think that's one that we've understood over the years, and what we do is kind of also understand where the organization is in their journey, where it wants to go, what we can do to, what are the gaps therefore in leadership capabilities, people, resources, finances, that it needs to bring together to be able to reach that scale. Say today they're serving 100,000, but say in 5 years they want to reach a million. So how do you make that journey possible, and what's needed? And once we understand that, we share that also with the donors, to be able to say that one is, yes, giving money for the cause, but also it's like you're investing in that organization's ability to meet that cause. And so how can you not just give the money and say, okay, here, run this program, or this is for the work that you do, but also really say that um, here's some unrestricted grant support for you to hire that additional person that you need, or make the changes and be more agile to what is happening on the ground. And I think organizations that have had that kind of support from donors and philanthropists have actually been a lot more agile post pandemic. Because once the pandemic hit, and think about in education, overnight schools shut. And so organizations really had to start, really thinking about, okay, how do we reach our students? What happens to the work that we were doing now? Now COVID has taken priority. Our communities need that, and we want to be able to do the COVID relief work, which is the ration kits, which is the safety kit that we want to provide them. But if an organization doesn't have a donor who understands the need to be that agile, and is like, no, but my money was tagged to only these outcomes, or whatever, like only this, then it's hard for that organization to be agile. And that's when that bridge is needed, and someone like Dasra can kind of support in making the donor side also understand why some of that is important, but also support the organization in building their own profile in that way, that they can make that ask, and making them kind of draw those linkages as well.
Right. That's a very important link which Dasra does provide, and it is definitely a challenge that again to the same trying to achieve the same goal, be it improving learning outcomes, but
Yeah.
then you have two fundamentally very different. A donor organization and a civil society organization, which are often on completely two different terms. But do you feel more recently there is like this gap of expectations, and the gap of aligning together has reduced? I mean, in the sense of more people from different sectors, like there's no clear distinction now between a corporate sector or a social work sector, but more people kind of jumping across. Do you sense that gap is changing right now, for better or worse?
Do you mean in funding, or do you mean just like in people being able to access it?
In terms of collaboration, in terms of like understanding the challenges, are donors, philanthropists, are they more open to understanding the challenges which come at the level of civil society organizations, where and vice versa as well?
Yeah, no, absolutely. I think there's definitely, and as I'm speaking to you, I am, at what we're doing right now also is um, kind of taking donors on that journey of what has happened in our country post pandemic. And there are some donors who come with a certain interest in, say, healthcare, so they want to know, because there's a lot of knowledge and information, I would say, actually out there, but you need someone to like skim that for you and to be able to put that in perspective as well, right? There's a lot of conversation that's happening. So there are donors who would come and say, okay, we want to really know what is the true situation on the ground. What are the actual struggles of the communities and people, and how can we support that? There are CSR foundations who are coming and saying that, okay, we was thus far supporting, say, schools, but now schools only have been shut for so long. So what are the trends in education that we're seeing? Everyone's talking about the rise of edtech. Is that the right way to go? Or are we looking at schools opening anytime soon, or should we think about vaccination? Should we instead think about making sure that communities are fighting vaccine hesitancy and getting vaccinated so that we're safer, and then we can think about opening schools again? So everything is so interconnected, and there is that information, and definitely, as you said, there is definitely is that interest from the donor community to learn more about the realities on the ground, and it's our job to make sure that we make that linkage possible. As Dasra, what we do is connect them to the NGOs to be able to sort of have that conversation and learn for themselves, and they can go through that journey.
Right. Thanks for sharing your thoughts on that. You mentioned about proof of concept and how organizations that have a proof of concept which has worked at scale, has worked at a smaller scale, and now they have the ambition to also kind of take it on a larger scale. It is definitely a completely different ball game, right? Like when we go at scale, because things
Yeah.
are less under your control, and the system kind of takes much over. What has been the experience of Dasra with organizations that are working in education and who have uh, kind of made this journey from having a proof of concept to successfully scaling up? Is what would be some lessons and some successes? What determines that? You talked about knowledge, technology, financial resources, the operational framework. What would be some of the learnings or successes for Dasra and its organizations that are working with it in education?
Sure. So I'll come to the example later, but I'll lay out the framework. So as I mentioned, in like organizations themselves go through that journey. You have that proof of concept. You double down. You know this works. You have the impact studies to prove that okay, when we started our program, this was the say if it was enrollment, we had 7 or 8% enrollment. We finished our program, we had now almost 100% enrollment of girls into school. So you have that study and you know that it works. Then it's you take it to say multiple districts, multiple states, and that's typically been the model that NGOs might follow as they are wanting to achieve that scale, or wanting to reach more beneficiaries. There are of course NGOs who also stay small and beautiful, and I want to kind of work say in one state or one district. But say if you're talking about organizations who kind of want to go on that scale journey, this is typically what they'll do. But then what happens is after you've done that for say 10-15 years, it becomes what we call as repeatable model. Now when I enter a new state or a new district, this is how I have to begin. I have an entire set model in place. First, I do this, then I do then speak to the panchayat, or I get the government official, I get my MOU, then I have my curriculum set. I will train the community workers, whatever it is, whatever be your model. Now you have that model set. You've documented, works well for you. You've done that for 10 or 15 years. But, and I think this may be specifically in education, but I think it applies to various sectors, just given the scale of problems in our nation, is you realize that you're probably not making a dent in the in how large the issue is, right? For us, we're talking, if I take learning outcomes in education, we know how further behind we are in foundational numeracy and literacy as well, and how important it is for us to invest in that. And say if there are organizations who have done that, they've covered Maharashtra, covered West Bengal, covered this. Now, how many states will you go to, and do you have that much funding capacity and resources to be able to become like that giant organization that present everywhere? Maybe you do, but most organizations realize that's too much to manage and that's not sustainable, and we can't be that organization who has all of these employees on our payroll, etc. It's not sustainable either. So then you start thinking about what is that disruptive or that third layer that you want to build. And often there, then the conversation is around engaging with the government, because government is the largest for the lack of a better word, player in the sector, especially education. Um, the government of India spends close to 200 billion on education. The private sector spends about a billion. So you just know that there's just so much reach of the government sector in itself in education, that for you to be able to reach that scale, you have to tap into that. And so a lot of the work around partnerships, around collaboration, around advocacy become important. So it's sort of saying that, okay, if you are working in 3 states and you know now how it works, how can you take that and apply it to, you know, all the states and union territories? And the way you want to do that is through the government, because they are present everywhere. Um, and that's how some of the TSU PMU models kind of come in. And I think one of the examples that just comes to my mind right now is Childline, the which is the 1098 number, which started as like a small scale, sort of model, and now was kind of run centrally by the government, but supported by, again, uh, the private sector a little bit, civil society a little bit as well, who now latch onto it to provide different kind of services to children who are in distress. So to be able to do that, to say that you want to reach that scale, means that you have to at some point let go of your own way of working and figure out how you can partner. The other way to do that is also other NGOs. So how can you take what you know well and kind of share it with other NGOs who can take that and apply it to where they are present? So you yourself don't have to be present in all the states, but there are NGOs who already work on education. That can they take your model and apply that? Can you make that open source? And that's really where this power of collaboration comes in. And often, and even in just my humble experience, I've seen that once you build something of your own, it's a little bit like, this is ye hamara hai, and it's like ours, and we will take it. So, but I think organizations who've been around for a long time now are realizing that if we really want to move the needle on the outcomes and reach all children, we have to be able to find partnerships, partner with the government, collaborate, and really step out of the comfort zone a little bit.
Right. Uh, the point which you mentioned about like that sense of ownership, right? That ye mera hai. So that it's true, and having a sense of ownership is great, but often we see that there is territoriality in terms of ye meri
Yeah,
territory hai, right? Whereas we, like you had said, that the scale of the problem, especially in education, and we now have a whole national mission on foundational literacy and news. It's huge, it's vast, and even if
yeah,
all the players kind of come together and work together, even then it seems like very ambitious to kind of achieve these goals at the national level. My question is that. Uh, do you feel that NGO collaboration, and because again education being it's like this huge pie which has these different aspects. There is teacher capacity building,
yeah,
there's the whole stages of education, parent engagement, now of course community engagement has become. So we have specialists or kind of players, organizations, governments who are bringing in specialized education. There's a lot to gain from collaboration, but do you sense that this territoriality is that something which kind of adds to certain challenges? And if two organizations are interested to collaborate, we sometimes see that the donors specifically might not be on board with that kind of a collaboration. Is that something of investment, and return to investment should be only for me, and should the credit should not go to someone else? Is that a problem in India, and what do you feel could address this problem?
yeah.
Sorry, it's a
No, I
very
think
big question. Yeah.
no, but it's a great question. I think you hit the nail on the head. It's like the elephant in the room whenever we talk about collaboration, because it's a bit like, I think, and I'm not speaking for any donor or anything as such, and just in general human nature. When we say we are collaborating, you have to let go a little bit of your. If I have to give an example, like your logo may not be there on a particular this, or it may not say organized by this one or that one. It will just say that it's whatever is the common project that we've come up with. That can be hard for I guess for a few folks, who maybe philanthropists or foundations, etc., and they might be very clear around the fact that no, this has to be very much driven by us. But I do think there are bright spots, and I do think we have begun to see, foundations and philanthropists who are willing to be more like this. It's okay if we don't show up, and this is really about the outcomes that we're working towards and about that collaborative and in the adolescence collaborative, it is a bit of that model where there are different donors who come together to support all of these outcomes in that one particular state. So I do think that there is that possibility. That's of course the philanthropy side. There's also the NGO side. There are also organizations, again, human nature to be like, no, this is, I've been doing this is fine for me, works well. I've got the government approval or whatever appreciation to be able to work in this state, so I'm okay. And that's fine. But then there are organizations who are beginning to also realize, okay, how long am I going to keep doing this, as I spoke earlier, this repeatable model in every state? Can I find someone to partner with and take this in another state? That way, my operational costs and expenses are not going to be spent in going to that state, but at the same time, I'm reaching the students in that state as well, because there's already an NGO who's working there. So can I just share, with them, build their capacity and to be able to do that? There are organizations who take a partnership approach, and then they fundamentally operate with that kind of thought as well. So I think it's about finding those bright spots and putting them together. I think we have to still see, we're nascent in this stage of collaborative and this way of working. So I think we have to still see the success of some of this, which will come years later, for, I guess, the sector to be able to trust that method of operating. And in India, we've begun to see a few, and internationally there have been many as well. There's also the collaborative conversation also brings then to how innovative funding can work, which is sort of saying you have a monitoring evaluation partner, you have a few NGOs, you have someone who's funding the start of this project, and should you achieve your outcomes, and somebody else will pay for that outcomes as well. So some of this pay for success kind of models are also being experimented in India. And to give an example, I think the Educate Girls Development Impact Bond is one of those successful, and we have data now to prove that also, that we know that they kind of reached all of their targets as well that they wanted to. So it was quite successful, and it was sort of like bringing different players in some ways in the room. So there are different ways of collaborating, and we have to now, to be able to really move the needle on our critical issues, have to put ourselves into that space and innovate and experiment with these models, because the usual kind of one NGO to one NGO, that works, but the time is running out, and we all know the damage that the pandemic has done. And so I guess there is an urgency to experiment with some of those models all the more, so that you're able to address the problem more holistically.
Thanks for sharing your thoughts on that, Shrutika. Moving on to how the whole sector of philanthropy and the patterns of philanthropy have been impacted due to pandemic. You did make a reference to that, and of course, we right now, of course, in like the short term, there are a lot of survival issues, and a lot of focus is on health and livelihoods and nutrition, and rightly so. But what is your assessment of how it has, what are the patterns which are emerging with respect to philanthropy in India, and with respect to philanthropy towards education? What is your assessment of like the short term to medium term impact of the pandemic on philanthropy and education?
Yeah. So one broad stroke, I think, before the pandemic hit, there was an entire narrative that was sort of in the sector, that India has now become a middle income country. We have seen a rise in the average income of per capita income, and so there was also a conversation of like, do those who are in, say, the US or UK or other parts of the Western world, do they still want to continue to give to India? We were kind of already seeing a decline in philanthropic funding, and instead moving to those countries that probably were further behind than we were. And then the pandemic hit, and it put forth a lot of the stark realities. And we know that there has been data that's coming out around how this has affected different indicators, including access to healthcare and access to education, and for children and students as well. So I think, again, through a lot of the retail funding and campaigns, etc., there is philanthropic funds that are now moving in back into India. Of course, largely initially they have been very COVID focused. So the what is urgent has become important, which is our healthcare, COVID relief and response work. So immediately oxygen concentrators, food, ration kits, etc. So there was a lot of support that came in there, and it has also opened up the conversation around the cracks in the healthcare system. So there's a lot of support and that's moving to that side. But then there is also the conversation that's moving towards education, especially for India, given that schools have been shut for so long. And I think we may, if I'm not wrong, we may be the only country that has shut schools for this long. We're close to almost 18 to 19 months that we haven't even opened them at all. And so there's a whole conversation on how this is impacting children. Their nutritional needs, their learning outcomes, how it's impacting those who are not connected to the online system and web-based things. So what can the donor community do to be able to support that? Because the gap is just widening, and you can't see that only as there are multiple impact. We know that, and I think Vishal and Sucheta in your talk earlier referred to it. If children have gone back into labor, we've sort of moved back on our indicators on child labor. Children are talking about facing domestic abuse at home because they've been living now at home for so long. They've lost the safe spaces of schools. And so there are multiple impacts, and there's a need for us to get the donor community to understand these multiple impacts. So there is a loss of learning outcome, there is a loss of a lot of other things. And so thinking about education with a child at the center, you kind of think about everything that needs to be addressed. And so that's how we need to look at where the needs are, and how we need to support students. I think estimates, though, are that given the push for COVID relief and healthcare, education financing is going to take a hit. And so they're estimating anywhere between 10 to 12% compared to how much was initially given may not be, will be the gap that we'll be seeing coming this year. But that's not to say that the needs of students have changed. In fact, enrollment rates have gone down this year than they were last year. So we are expecting that enrollment rates will actually be twice as worse than they were previous year. We know girls have already dropped out of school and getting into early marriage because schools are shut, colleges are shut, incomes have been hit. So that we're going to see a sharp rise in that. So I think there is an urgent need to address education gaps in education. We need to open schools. We need to focus on learning. We need to focus on needs of children. And we need to create a lot more conversation and dialogue around that. Because the healthcare conversation, and rightly so, has of course taken precedence. But there is this layer that's going to come when you open schools. You will realize just how further behind we are than where we began. So there's a lot that we have to do there for and build that understanding as well in the community.
Right. Another question that I also had was to do with how are civil society organizations, and the CSOs are of course one important stakeholder and audience for our talks. And Dasra works with many civil society organizations. How have they adapted their own operations, specifically those who are working in education, to the pandemic and to the the realities of the pandemic? If you like to share some
Sure.
thoughts or like lessons from there.
Sure. And I think just kudos to the civil society. They've just been so agile and responsive in the needs of communities and students. We've seen some wonderful innovations and just work that has happened while risking their own lives in many ways. So I think one of the few things that we noticed, right, and this may be limited in just our understanding because of the NGOs we interact with, and I'm sure there might be many more. But a few things that we noticed was, one, it was immediately about just care for your community. So a lot of NGOs then pivoted their work, and that's where my point earlier around donors who were agile and unrestricted in their funding were able to those NGOs were able to be a lot more agile in these times. Address the needs of the community in the lockdown through like ration kits, because lockdown was almost overnight. We had reverse migration happening, loss of income, etc. So first was just need of the care of the community. But if you think about education, a lot what happened was also very quickly organizations moved into web-based learning. So WhatsApp became a really important medium to be able to keep in touch with students. Teachers, some of our frontline workers from our NGOs also like creating quick videos, sending that across. That was sort of happening. The third was helplines were set up. I think some of the NGOs that we know of set up their own helpline, and distributed that number to the students to be able to call should they have any queries, should they have any distress at home. So just again, ensuring that for students was safe, and then using that medium to further some of the learning as well. Um, and there were different ways in states set up their own applications. I think Jharkhand has something called Digi Sati app, if I'm not mistaken. And there's also centrally we've had one digital app which then students were asked to kind of go on that. But it happened slightly more ad hoc. But again, they were quickly kind of adapting to it. Um, Another sort of thing that we saw, and I think it was mainly in Chhattisgarh, was these mohalla schools. So sort of going into communities with the mask, with two students, safely distanced, you're still kind of continuing the learning. So I think that was one thing that we saw where they were still trying to reach their students, but in small kind of clusters rather than bringing them all together. So these were a few ways that NGOs kind of very quickly adapted. Of course, first was response to COVID, and then ensuring students were safe, and then supporting their learning through some of these methodologies. And I think what we are also noticing, and just in conversation also with some of the organization leaders, is we need to capture these best practices, or these sort of quick fixes that NGOs have led to, because there's some of them have now been doing it for almost a year and a half, and they are continuing. They figure out a way to reach the students and continuing to kind of ensure their safety and their learning as well. So how can we use that as, is there some innovation there and some model there that we can learn from and probably scale up and apply? And I don't know if anybody is doing any work in that zone, but I do think there have been some great experiments that have happened that have served students really well.
Wonderful to learn about these examples. It's truly inspiring the work which organizations, individuals, and the leadership
Absolutely.
and not thinking about like things like funding, or is this really my role to do to come and do COVID response, etc. Like these things, it's really been inspiring to see so much of volunteerism and of like selfless service which has come. So thanks for sharing these experiences. um, uh, Another question that I would like to ask, and it's again kind of referring back to the conversation we had on the collaborative aspect, and what are some of the bottlenecks or some of the gaps which kind of prevent cohesion and collaboration. I would like to take the example of the new mission, the Foundation Literacy and Numeracy mission, Nipun Bharat, and we are talking about a holistic approach towards developing these skills. It's not just about the curriculum or the pedagogy, but like Vishal and Sucheta also added today morning, that it's about keeping the well-being of the children right at the center
Yeah.
of it. The health, what you talked about, the health and the nutrition aspect of having a healthy learning environment, of having a print-rich environment, of a culture of reading. So these are like a lot of pieces of the same puzzle, and when they put together, that's when the intended outcomes will actually be achieved. Um, so putting together a holistic picture and a holistic approach requires knowledge and different experts to kind of come together,
Yeah.
to form something which is very useful and holistic. Uh, are there any examples, which with respect to Dasra's projects, or any other initiatives where you feel that a holistic approach to education, and of course, pandemic has told us more than anything that you can't really segregate
Yeah.
learning outcomes and health and mental health and all these things. Where so, is there any example where different organizations working on different sectors have been able to come together to provide a holistic approach, and how have philanthropists approached that kind of a holistic kind of a program?
Yeah. Um, so I can share a little bit from my experience, but I have to caveat that by saying that we're at a very nascent journey. So this is early learnings, and but when we began the adolescent collaborative, we started with the idea of comprehensive programming, which was to say that, as I mentioned right in the beginning, that when we think of the needs of our students, we can't think of it in silos and say the student only needs learning and nothing else. When you ask a student what they need, they will say, I want to learn also. I want to be safe as well. I want to be healthy. Because I, as a teacher, also remember I would go to school, everything prepared, but if students were falling ill because they didn't have, clean drinking water, or their nutritional needs were not met, they would forget, or they would just be behind in learning, etc., because they were not that energetic and healthy. So all of it, like you said, is connected, right? And so I think when we take that collaborative approach also, and as we did in the collaborative, we really discussed about also just what were the outcomes that we were working on. And the outcomes in itself have to then be holistic in nature, keeping really the beneficiary, and in this case, our student at the center. So we keep the student at the center, and we ask, what do they need? They need to meet their healthcare needs. We need to ensure that they stay in school, because dropout is one of our biggest issues. We need to ensure that they meet their learning outcomes, and we need to ensure that they are empowered. And say if we take, and I'm just hypothesizing, say if we take these as the outcomes, and then we create a dialogue around that, then you have to also get the donor community and philanthropists to understand that if you only worked on healthcare and did not think about education, here's why it's important for you to think about it, because students need everything and they are all interconnected. So there's a journey that they also have to go through in learning about these interconnections, understanding why that's important. And you will, like I said, there are bright spots. You will find that there will be a donor community who kind of support that and say that, okay, if these are the outcomes, and I'm tying myself to the outcomes, I'm not tying myself to what I think is important or what I need, etc. And organizations would also do that. And so it's about saying that if an organization was for years working on healthcare, say in improving the sexual reproductive health awareness of students, then can they also take on the mandate of ensuring that they stay in school and complete the school, and also make sure that they're learning through that well. So how can you use your existing program and expand it to the holistic needs of your students? And it kind of is a chicken and egg, because the funder community also should be open to supporting that, and the NGO should also be willing to kind of invest in the resources and to be able to do that. But you can find, and I think once you do that, that's what the power of collaboration is for that beneficiary. And that's, I guess, how it works, is just to say that what are the outcomes, keep the student at the center, ask yourself what do they need, let's design the outcomes around that, and then have a conversation and dialogue that they're working for the outcomes. And so it becomes an outcome based funding approach. And then there are many facets to that, right? You can outcome based funding sometimes kind of refers to, you get the funds only if you meet the outcomes, but it doesn't necessarily have to be that way. It could also be that you're working towards the outcomes, and you get the support and funding for working towards that. And there can be different mechanisms in how you get financed, but it's possible. I do think it's like I said, we're still nascent and young in the journey of collaboratives in India. And there are many more experts out there who know about this more than I do, but this is just a little bit from my personal experience also on being a part of the collaborative and seeing some of that. Therefore, I believe that if we have to tackle our foundational learning literacy outcomes, we need everyone to care about that. it shouldn't just be the civil society who works on it, and then there's a government who works on it. We need everyone. We need the private sector. We need to figure out how we all work together, to be able to kind of tackle that problem. So that's a little bit on just how I think it might help.
Very interesting. Another question when you were talking about the adolescent initiative was that that suppose that there is a particular goal which is to improve learning outcomes, right? So first of all, of course, like for a student, it's not just learning outcomes, but so many other things as well. But suppose it's learning outcomes, there are many pathways and interventions to help aid that, right? Like so, learning inside class is one of them, but it's also safety, infrastructure, social emotional well-being, and all these different aspects. So when different interventions which are complementary in nature move towards achieving an outcome, any thoughts on how do we evaluate the impact of these different interventions separately, or do we always have to evaluate its impact as a holistic approach rather than these four interventions and they having
Yeah.
corresponding impacts?
Yeah, no, it's a great question. I think it's so important to talk about monitoring and evaluation in any of this, because that's the key pillar to know what's working and not. And I think in response to your question, we can do both. You could also find out what the impact of the separate interventions were, but also take that outcomes based approach. And the outcomes based approach, in my opinion, should be non-negotiable, because then you never know whether or not you actually achieved your end goal that you started with. But the outcomes take time. So if you have to say the outcome was, for the student to be able to find a, transition into secondary at grade level, that's going to take some time if they are at grade one right now, and you may be still teaching them with the tools of foundational learning and numeracy. But you could track that at least to say that, okay, how much improvement is there now in the reading and learning level through this intervention or this intervention. But then you also track towards, after 5 years, whether they were able to transition to secondary, and were they also emotionally like whatever may be the outcome for say socio emotional learning or some of the other healthcare outcomes. So whatever be those outcomes, we still tie ourselves to it, but we make them slightly more long term. And then you have to figure out what might be those intervention based outcomes that or outputs, I would say, that you could still track. And I'm again not a monitoring and evaluation expert, but I know from our time in the sector that that's possible to do. And you can have intervention based learnings, outcome learnings as well. Say this intervention worked this way and that way, and then also do another baseline and end line for your for 5 years from now. I guess the only thing about that is we don't have the time. Like we don't have 5 years to wait and kind of see whether or not this will work, right? So I don't think that needs to continue. We should still do that, but we need to have some of this, doing and then learning kind of approach as well. So these short evaluations also that you could do, that give you quick feedback and data on what's working, so you're able to also improve on that and move forward. While the 5 years longitudinal study, etc., is very important, and we do that, we shouldn't wait 5 years to be like, we then find out whether it worked or no. So we need something in the interim, and I think there are, if we speak to the MEL experts, I'm sure there are ways to do that as well.
Thank you, Shrutika, for sharing these thoughts, and it's truly been a very enlightening talk. Learning about these ideas, and you've really helped kind of create certain templates in our minds and in the minds of our audience on what could a collaboration achieve, right? And collaboration, like when we no one says that collaboration is bad, right? Everyone talks about that there should be collaboration, etc., but it's actually when it comes to the nuts and bolts of the actual collaboration happening is where a lot of challenges happen. And you've really shed a lot of light on the dynamics of collaboration, what are the different ways in which collaborations could really work and achieve both the larger goal as well as the say the ambitions of organizations to have their individuality and to have to have good impact of their work, etc. So thank you so much for kind of taking us through that aspect. And And like you said that we don't have a lot of time to in terms of evaluation also, right? Like it is important that we are doing evaluation, of course, seeing if things are working, but it has to happen um, uh, you know uh, at the same time. It has to
Yeah.
happen concurrently with the interventions, and same would also go for approaches which have a collaborative approach as well. And this is something, of course, which truly wonderful work being done by you and your team and Dasra with respect to creating that bridge between the organizations and people who support, who give the financial support, with the organizations who are giving the knowledge and the action in terms of social impact. So once again, thank you so much, Shrutika, for your time. Really appreciate it.
Thank you so much, Mashood. This was great, and it was nice. It was actually great for me also to kind of put these thoughts out there. So thank you for giving this space. And should anyone want to connect or know more, happy to kind of speak about this later as well and connect separately. Thank you.
Absolutely. Thank you, Shrutika. Thank you for your time.